What is Alzheimer's disease? Dementia is a syndrome characterized by impairments in memory and loss of cognitive functioning. So the person can remember everything and she or he can carry out the daily task in an appropriate way. So it causes a huge decline in the patient. Exactly, Alzheimer's disease is a progressive and irreversible dementia that causes a disruption in the memory, and the person can speak in a appropriate way. Who was the discoverer? He was a German physician called Alois Alzheimer. In one moment he treated a patient who was called August, and she started forgetting everything, and she thought that her husband was being unfaithful to her. So when she died, Alois Alzheimer decided to perform an autopsy in her body. So he discovered strange structures such as deposits which were fatty in blood vessels and in the cells, in the nerve cells concretely. So these deposits could be plaques and tangles. The plaques are deposits of protein which is called beta amyloid that accumulate in the spaces of the nerve cells. Meanwhile, tangles are deposits of the protein tau that accumulate inside of the nerve cells. So it causes a block cells' ability to communicate with each other. This block is in the nerve cells. And normally all these nerve cells are going to die. Beginning of Alzheimer's disease. Above all, this disease is the most common cause of dementia among elderly people. The 2 to 5% is in patients that develop the disease in the 4th or 5th decade of life. Meanwhile, over 85 years of age, there is a 50% approximately that develop this disease. In addition, patients with Down syndrome will always develop this disease over 40 years of age. Alzheimer's disease can be genetic or not genetic. When it's genetic, can be an early onset or a late onset. When it is an early onset, it's caused by a mutation in the chromosome 21, 14 or 1, and it's caused an increase in the beta amyloid proteins. In addition, every people who have Down syndrome is going to develop this disease. Other kind of Alzheimer's disease can be late onset, caused by a polyprotein E, which is situated in the chromosome 19 that helps carry the cholesterol in the bloodstream, that can be 2, 3 or 4. And the number E4 is the one which is going to be responsible for developing this disease. And there are non-genetic causes which can be toxins, viruses, prions, low level of education, and other things like high blood pressure, diabetes, or obesity that scientists think it's related to having a cognitive dysfunction.
One of the most common signs of Alzheimer's is memory loss, especially forgetting recently learned information or asking for the same thing over and over. They also may have difficulty concentrating and take much longer to do things they did before. They also may find difficulty completing familiar tasks at home, at work or at leisure. Confusion with time or place, and trouble understanding visual limits and spatial relationships. They may also start to have difficulty with words in speaking or writing. They begin to lose things and being able to go back over their steps to find them again. Their judgment begins to decrease, and a person with Alzheimer start to remove themselves from their hobbies and social activities, and finally their personality or mood can change as well, and they can become depressed, anxious. I'm going to talk about the stages of this disease. Stage 1, no impairment. The person does not experience any memory problem. Stage 2, very mild cognitive decline. At this stage, the person may feel as he or she is having some memory lapses, but they are not detected by any medical examination or by their friends or family. Stage 3, mild cognitive decline. This stage, friends, family and co-workers begin to notice that they are having some problems with their memory. For example, they have some trouble remembering names, and they have also problems remembering material that one has just read. Stage 4, moderate cognitive decline. At this point, a careful medical examination should be able to show some problems in several areas. Patients may have problems remembering some details about their own history, and they can become moody in some situations, especially in social and mental situations. The next stage is moderately severe cognitive decline. Gaps in memory and thinking are really noticeable, and they begin to need help in all their daily activities, such as choosing the proper clothes for each season, but they still remember the most important details about their lives, and they still don't need help in some activities like eating or going to the toilet. The next stage is severe cognitive decline. Memory continues to worsen, and they really need help in all their activities, such as dressing properly, and they may also have difficulty controlling their bladder, but they still they also have some problems in their sleep patterns and tend to wander and become lost. Finally, the last stage is very severe cognitive decline. In the final stage of this disease, individuals lose the ability to respond to their environment. They still say some words or phrases, but they are not able to continue a conversation.